Welcome back. This is part 5 of this presentation by admissions helpers on writing a successful personal statement. As you recall, in the previous section we discussed how to organize the content in your personal statement. We expressed that every personal statement should have an introduction/background, a series of body paragraphs, and a conclusion. There are many different ways to organize the body paragraphs. One of the approaches that many students frequently take and we'd like to discuss here is a personal statement in which each body paragraph is devoted to a certain type of activity. Students frequently like to take this approach when writing their essays. They'll have an introduction, then in their first body paragraph, they'll talk about their clinical experiences in medicine or dentistry or pharmacy, for example. And in the second body paragraph, they may talk about their research. And in the third, they may talk about community service. And in the fourth, they may talk about athletics if they've been involved in athletic activities, or teaching, or art, or some other thing that they've been involved in. And then they'll finally end the essay with a conclusion. This is a reasonable approach for the personal statement, but it's important if you're going to organize your essay based on activities to avoid making your essay sound like a rehash of your CV. So how do you do that? How do you avoid making your essay a rehash of your CV? It's important to focus on the following elements as you describe the activities. You want to introduce the activity. Tell the reader what the activity was, but not in too much detail. You want to discuss your motivations for getting involved in this activity. And that's, again, something that may shed light on what drives you. You may want to briefly state what your role was. State that you were a volunteer at a hospital, for example, just so it's clear that you were serving as a volunteer. Then you want to go back and talk about your skills. The skills that you gained from doing this activity. And it's important to not just focus on the technical skills, but the more broad skills that are transferable from one setting to another. If you were involved in research, and you were doing some complicated experiments, don't just talk about the laboratory techniques that you developed, but also talk about the patience and the perseverance, and maybe the attentiveness to detail that you developed as a result of doing these laboratory experiments, and how those skills will carry over with you to your endeavors, such as patient care. It's also important, as you describe these activities, to talk about how each activity helped change your perspective. If the activity is relevant to healthcare, talk about what you learned about the profession as a result of the activity. If you worked in a clinical setting, for example, express what you learned. If you did research and maybe studied some particular disease, talk about how studying that disease made you more interested in medicine. Illustrate how the experience helped you develop a more mature and realistic understanding of the profession. Discuss what you saw during the course of the activity that escalated your interest in the profession that you want to pursue. One of the things that's really important as you're describing your activities is to recognize that yes, most applicants do have clinical experience, and most have research and community service experience. It's okay if you're describing an activity that other people have. The activity does not have to entirely set you apart from others, but how you reflect on that activity is what should set you apart from other applicants. And that's one of the most important messages that one should take away from this entire presentation. This concludes part 5 of writing a successful personal statement by admissions helpers. In section 6, we will continue on the final steps of putting together a personal statement. Thank you.